Aloha, everyone. Welcome to the Be Activating Practitioners Call. Today is a little bit different. The call is going to be hosted by myself, Sheila. I'm here on Maui, and the beautiful Jan Rand down in Southern California. And Marcy is on an airplane right now, going to Houston to host an event in Houston for LifeWave. Yes. So I will admit, I am not used to running the practitioner's call, and I do know we have an amazing doctor here, Dr. Patty DiBlasio, and we are going to bring her up too. But first of all, what I'd like to do is let Jan say good morning to you.
Good morning. I've been up all night because I didn't want to be late getting Marcy to the airport. So anyways, I am here to help answer questions, assist in any way possible, and I will put my number in chat. And if anybody needs me after this, I'm always here to help anybody with anything. And if I don't know the answer, I certainly know how to get it.
Absolutely, because Jan Rand is the boss. All right. She's thinking, So, Dr. Patty, can you unmute, bring yourself on to there? I see you. There you are. Dr.
Yes.
Patty is
Hi
here.
there.
And what amazing nuggets. I'm sure you have something to share with us today. What can you share for LifeWave with us?
Well, I think the best thing I could share today, first of all, hope everyone had a wonderful holiday, Thanksgiving, and it's good to see all of you again. And I always share just sort of my strength and hope. It's personal. I'm not giving any medical advice or diagnoses or treatments, but I'm just sharing with you some of the personal things that have happened with me and sometimes even some of my patients. But I would say the best thing I can say is I've now been using the patches. This is into my 7th month. And I can say that they are still as effective as they were when I first started. And I'm seeing many new benefits over the last couple of months. And I tell my patients, use the patch for every year, every decade you are, 1 month. And so for me, that's 6 months. I've been using them, and that's supposed to be basically our regenerative time, right? Our repair time. And then we can begin actually, hopefully, finding some signs of reversing some of the age-related problems that we have. I can't even say how many things have been happening recently to me in regards to greater energy, less pain, and better sleep. And so it just continues to get better.
Outstanding. I just hit on the November 26th, I hit my 3rd year anniversary of wearing the patch. And I have to say, my life has changed amazingly as well. And I was wondering if you would be willing to let people open their mics and ask you questions today, Dr. Patty.
Sure, I think that would be great. And I'll do the best that I can in providing generalizations for questions or specifics if possible.
I just want to add one little thing. Don't ask specific questions about specific diseases, because that goes against everything that we're allowed to say. It needs to be, you can't say, well, I have diabetes, will this blah, blah, blah. But Dr. Patty knows how to answer those questions. Let's be mindful of that. Okay.
Great, yes. Thank you.
Who has a question for the doctor? The doctor's in the house. Anyone on any patches, any questions? I have a question. Can you explain the difference between the X39 and the X49?
Yes, so the X39 is going to help us to activate more stem cells, help the stem cells that we have left, fewer and fewer as we get older and sicker in more toxic environments, but whatever we've got left to be better and to work better. X49 does the same thing, but with a different pathway in the body to activate. And X39 uses GHK copper That is a peptide that is activated in our body, and it is more helpful in general for sort of likely even resetting studies. Some of our studies show likely even resetting some of our genes, maybe as many as several thousand, to more youthful states. And so we notice usually with it things like better sleep, more energy, and less pain. Those are the key indicators for X39, although it does many other things. The X49 activates another peptide called AHK copper. And peptides are just short chain amino acids. And it's just one amino acid change to make an AHK copper peptide for X49. And it's going to activate a little bit more areas where we're increasing our metabolism and making it more effective, burning fat into muscle, having better performance in workouts, and maybe providing some 5G support. So those are the main differences between them. They work synergistically together, and they're sort of the premier patches of LifeWave.
Beautiful. Thank you for sharing that
Thank you so much.
explanation. We have a question for you, Dr. Patty. Cynthia is wondering if you've had a chance to use the new aromatherapy products, Shine and Dream.
I just got those actually, and I told my husband this morning, I said, we're going to start them this weekend. So maybe I'll have a report on that next week or the week after. I try to come to as many of the meetings as I can. I have to miss a few of these, but I love them so much. So I'll give you a report soon. I do have them, and I'm looking forward and excited about them for sure.
I've been using the Dream since the event in August. And I'll tell you, every night I go to bed, it's like going to the movies. I have the craziest, most intense, precise dreams. It's like literally like going to a movie every night in your bed and just major feature film going on in my head. And I've always had a hard time sleeping. That Dream works really well. I gave my Shine to my husband, so we'll see how that goes.
You're so sweet. It does. And you know what else it does is it allows for me to sleep longer periods of time as well. Have you experienced that, Jan?
I'm sleeping a solid 8 hours at the movies in my head.
Well, we have another, I have another gentleman, friend of mine, that has been on the Shine and the Dream since the convention. And prior to convention, he had actually gone to his physician. I believe his 74 years old, I think is his age. And he had his blood work done prior to convention. He did Shine and Dream for a month, and his testosterone levels were elevated almost 130%, which is one of the things that
Whoa.
told him, right? Bob, right? I believe he's going to be on the
That was going to be my question.
I think
Go
he's
ahead,
on
I'm sorry.
Patching podcast, possibly. And one of the things David Schmidt talked about at convention was the increased level of hormones in our bodies. So get your Shine and Dream if you haven't got it. Okay, let's see. Over here,
Okay, we'll come to Cynthia Beck in a second to hear her story, but doctor, somebody wants to know about if somebody's getting a rash from the patches, from the sticky part. What would you recommend?
Yes, I've had a little bit more of that myself over time. And I do have a few patients that have that. It's not too many, and it's not anything significant, except for one on the back of my neck that I had, that I got a little rash that lasted about 3 or 4 days. So what I'm doing now, and I haven't had any problems since, and one of my patients that's super sensitive said this has worked for her too. And I'm telling all my patients now to just not use the same exact site every day if you have any issues like that at all. I am like the most super sensitive person that ever walked the face of the earth, which is why I think I can understand my patients. I tell my family, I say, if I were to go to a doctor, they'd think I was crazy with all the symptoms I have. And so if I can figure this out, I think pretty much anybody can. So I do alternate my sights just a little bit. So I just move it a little lower or a little higher below my belly button, or a little bit more off to the side. I change it. I use X39 and 49. Like today, I have it on my wrist because I have a sore wrist. So I do move those around a little bit, but I'm finding that then I'm perfectly fine. And even if I take it off and it looks like there might be just a little imprint, I don't get any rash at all. So that's what I would suggest. The biggest thing is just to alternate your sites. And I think you should be really good. If I hear someone isn't, then I'd like to know about that.
Okay, so another thing that you can do is the sticky part doesn't have to be against your skin. So for people that are super sensitive, you can put it like on the inside of your underwear or clothing, and it works exactly the same way. I had somebody calling, they couldn't figure out how to put it on the collar for their dog. And you just put the sticky part on the inside of the collar and it's still working. So it doesn't have to have the adhesive on the skin. So,
Jan, I got a
Right.
question.
yeah.
Okay, Dr. Patty, okay. My guy back in New Jersey's online with me right now. Jim, you on there somewhere? Okay. Here, and I was going to ask this question too. I'm pilot. We're going to go back into the AHK and the GHK, okay? So can't ask why this modified to affect GHK and AHK, vice versa, other means, okay? Can we dig into the AHK and the GHK a little deeper and try to figure, why, what goes on there?
I'm going to move because I've got some noise outside my window here. So give me just
Close
a
the window.
second.
Works. Take your time. Hey,
So
Jim, are
this-
you on there somewhere?
Who?
Oh, I'm in Colorado. Jimmy's in New Jersey, right? Let me just see hang on. Let me see if I can get him online here. He had a question here. We're very high tech here. Not really. Okay, hold on. Hey, Jim. Hello. Answer your phone.
Okay.
All right. What's your question? Can you see us online here?
Well, I did a call in because I don't have a camera, unfortunately. And I just dialed in from my cell phone quickly for this call, so I didn't go through the Zoom.
Ask your question.
Okay,
My
ask the
is
question.
basically this. Wes had introduced me to the patches a while ago. And I certainly understand the process of using light to affect the body. And I know Patty probably knows medically known as photophoresis, where they do different things to the blood. And I know there's other pathways, but effectively what's being promoted here that I can clearly see is that these patches are looking to affect GHK, which is the activation for the stem cells, and the AHK, which is working on light pathways from the patch back to the body to affect these changes. And I was wondering whether other modalities such as red light therapy that I know has been involved with many like saunas and health clubs, whether some of these other pathways are working effectively the same way, or how and why these patches might be superior to some other pathways to affect what you're trying to affect with these patches.
Well, that's a good question.
I think we can say that that's where we sort of trust David Schmidt, and he's done the studies around these particular peptides and how we can stimulate them in the body. Both of them use the photolight therapy. It is infrared light that our body pushes out, and putting the patch on that specific energy meridian in the body, or the specific area that needs healing. He has shown that to be helpful. All his studies are around using energy meridians and not just like putting it on my wrist, right? But we have found through just sort of use that many people find that benefit because stem cells do go to areas of inflammation. So if you have a sore spot, it makes sense that it might help that spot at least to feel better. But overall, for sort of your general well-being, using the patches in the places that he has actually tested and shown to be effective, I think are usually the wisest ways to go. infrared light beds in gyms, they absolutely do help with healing, and they're stimulating that frequency of light in our body that we know is healing. So it's a similar way of working, just a little bit different.
Okay, essentially, I guess what you're saying is this way you're walking around with it at all times versus potentially going to a spa for 20 or 30 minutes. This is something that you're actually wearing, you know, for the recommended, because I did actually, through Wes, read the literature on this, that it's something like eight hours on, or 8 to 10 hours on and 10 hours off, and you know, effectively, you know, trying to work things that way. But I guess really the way you've answered the question, at least if I understand it properly, is that it is essentially working the same kind of pathway. It's just which way do you want to go? Whether you want to go with a red light therapy, you know, at a gym, or whether you want to wear these patches. They're both trying to do the same type of thing.
Yes, except the patches are a little bit different, and I think this is key. We aren't doing anything externally to cause our body to do something. We are just simply tapping into our inner healing of the body. And I like that. It doesn't, infrared light beds are great. I've managed clinics that actually have them in their clinics, and they're wonderful, but they're costly. They take time, and it's something coming from the outside in. So this is something that we're on patches. Usually we say about 12 hours on, 12 hours off. So you're able to get that benefit in a very cost-effective way. And it's stimulating your body, just turning that red light back into your body for its own healing. So I think that's pretty key. And that's what the patches are so good to do.
Okay. One other question, if I can. I was actually on last week's call for a little while, and I don't know whether it was you or another doctor that had mentioned for some patients, they had apparently there's a means of actually delivering GHK like through a injection of some sort. That almost sounds like it might actually, in my mind, be dangerous in some ways, or I don't know, maybe you could explain that to me, you know, from your medical background, how that might be delivered in a different way.
Sure. I'll answer that. And then I believe maybe Denise had a question too, and I'll let her ask that in just a minute, or whoever that was. Yes, I have mentioned this. It maybe someone else has too, but the GHK copper is available in an injectable form. I was using it with patients and with myself before I knew about the patches. And you inject yourself every day, just sort of right under the skin, like an insulin syringe, very small, tiny needle. And you do it for a cycle of a month. You cycle it off and on. So you do it maybe every 3 months. It is expensive, and you have to be someone that's willing to put a little needle. It's tiny and barely fill it, but many people don't feel comfortable doing it. So the patch, and now that I know about the patch, I tell patients this is just so much easier. It's about a third the cost, and then you're getting the constant benefit of 12 hours on and off. So I like that. So Denise, was it Denise that had a question?
Yep, that was me.
Oh, okay. You're right next to me on the screen, so I guess that's how I saw it.
Well, two things really. I'm 52. I've had an autoimmune issue for a very long time. And recently it's really been catching up to me. Someone turned me onto the patches just recently. I'm very new to this. And to tell you the truth, just sitting down and getting up, I would like walk like Frankenstein for a while because everything was so achy, ankles, knees, hips, that sort of thing. And after even a week on the patches, I've seen a significant difference. Like I don't walk like Frankenstein anymore. You know, I get up and I can actually walk. So it's great. So I'm looking forward to really moving forward with this. So my question is, two questions actually. Well, yeah, two questions. How do I use the trio of the YH best together with my X39 and 49? And the other question is, I'm glad that gentleman brought up the infrared light because I also teach advanced aesthetics. And I know that infrared light is great, but I was under the impression, I kind of like told myself that the patches and the red light would really even work well together. Like right now, I would never give up the patches because nothing's made me feel this good. But I'm saying that would the patches maybe help the infrared light treatment?
It's possible because you'd be getting sort of an external and an internal treatment. And so you may not need all of that. And for some people, they are costly, but I think that certainly you can try it. And if it seems to be good, it does feel good to lie in one of those beds. I've done that before myself and they do feel good. So I don't think it's a problem. You're asking about the set of the glutathione and the carnosine and the Eon patches and how you could use those. Is that correct? Yes.
Yes.
Okay. Yes. Okay. So those are wonderful patches. I do feel like that Eon is very important. And I pair it with the X39 for my patients because main thing that it's doing, it's helping to decrease inflammation. And it's quite has capabilities of longevity and so on. But the way that stem cells work, they're like honing birds in your body, and they go to the areas of greatest inflammation and they prioritize that, right? So if you have maybe a liver that's a fatty liver, let's say, and you don't even know it, right? Or maybe you have high blood pressure, you don't realize it, then the stem cells are going to go to those areas of treat first. So you might not feel any immediate benefit of more energy, let's say, or better sleep. But if we can get some of the inflammation down in the body overall with Eon, it pairs so well with the X39 as it not only decreases inflammation too, but then the stem cells can begin to work in some of the areas that maybe are more prominent for you, like for me, a sore wrist or whatever. And so I think Eon is great to pair. Carnosine and glutathione, I've heard David Schmidt say, those are great patches. You might not have to use those every day. Carnosine is great. I use it at night. It helps me sleep better. I pair it myself at night with Eon, carnosine, and Ice Wave. And I find I get even better sleep with carnosine. Some people use it in the daytime, but it's good for the heart, good for the brain, and very rejuvenative. But you might not need it every day. Glutathione is the same way. Glutathione is our master detoxer. And I love the glutathione patch because I've never been able to take glutathione as an oral supplement. It would make me too weak with my autoimmune disease. But I have built up to now using glutathione 3 times a week for 12 hours. And I started using it 1 hour a day and building up. And it took me about 3 months to build up to, what I'm able to do now. And so I think it's excellent. We all need to detox. So those are sort of supplemental patches to use, from time to time if you wish. And Eon, I would say I would pretty much use that one every day. That's sort of my preference myself and what I tell most of my patients in general.
Wonderful. Thank you.
Yes.
So next up, we have Midge has a question, and thank you for raising your hand.
Oh, yes, thank you. My daughter just broke her right hand. And as you can imagine, it's all bandaged up. She's going into surgery tomorrow to have the bone, some support system going into her hand. But what I'm asking is that right now, where does she put the patches?
So again, I can't give any personal medical advice for any specific condition. So let me just give you some generalities of what might make sense based on what we know about the patches. Anytime a patient is involved with another physician, like a surgeon, I do say that they need to speak to the surgeon or the endocrinologist or whoever their cardiologist. because the patient is under that doctor's care. And so they need to let them know what they're doing. Most of the time, Western medicine doctors don't know about it, and they very likely may say, don't do it. And so because they're under that care, let's say something, they put the patch on, your daughter puts the patch. Where did you say, what did she break again?
Her hand.
Her right hand?
Yeah, her right
Her
hand.
right hand. So she puts the patch, let's say she puts the X39 and the ice wave for pain on her area of greatest pain. Eon, sometimes you can put 2 eons kissing, they call it kissing, just side by side on areas, and sometimes that can be very helpful. But let's say she does that and then something doesn't go quite right with the surgery. Well, if the surgeon finds out she was using something that he had not authorized or she had not authorized, then they might blame it on the patch. And then the patient wouldn't know, oh, maybe I shouldn't have used the patch. So I do say they should defer to their doctor of specialty when they are in those situations. I do think that the best things for pain are, and I know Marcy had broke her wrist, and she's been using X39 and Ice Wave and Eon, and I think even X49. Some of those she would have to speak, to that directly. She has spoken to it directly, but I'm not sure of the exact details. But those are some ideas. But I would say, you have to go to your doctor that's working with you in those areas.
Okay, thank you.
And next we have iPhone. Your hand is raised. You need to unmute for us, doll. Are you there, sweetie? iPhone. I'm not sure who it is.
The iPhone typed their question in the chat.
Okay, so it says, I was talking with my physical therapist, and they said to me there was no data supporting the patches in the orthopedic department. Let me know your thoughts to pass on to him.
So I'm not sure what they would mean by there is no data in the orthopedic department. I'm not sure what that means. You could simply refer this person, this therapist or practitioner or whatever, to the studies that we do have that are on our site. And so we do have a number of studies that are very over 70, maybe close to 80 studies of effectiveness in different ways of the patches. And Stacy, not Stacy, but Sheila, I was thinking about Dr. Stacy too. Sheila could maybe show everyone where that can be found. And then certainly they can look. Most of the time, Western medicine people aren't going to want to look at these things. And they may dismiss them, but that's okay. We have some studies, and we have many case reports that we know they can be very helpful, not necessarily for everybody, but when used the right way for the period of time they need to be used, for most people do see some benefit.
Okay, you just wrote that actually work in the orthopedic people. What does that mean? What is the statement? I'm not quite sure. iPhone. I can tell you that I wrote this message to her personally. I've been on the patches 3 years, November 26th. When I started and Jan met me, I had just quit walking with a cane. I thought I was going to walk with a cane for the rest of my life. I don't have an ACL. I have 0 cartilage. They took out all of the scar tissue. And so it's literally bone on bone on bone. And I have told David Schmidt multiple times in person, thank you for creating my miracle that helped me. So, I've had 4 knee surgeries and I'm walking again. Dr. Patty, we have a question. Are nerve cells in the spine as easy to regenerate as, say, tissue cells? And basically, do stem cells regenerate nerve cells in the spine?
When I was using stem cells in my clinic, it's no longer allowed by the FDA. But when I was doing that, I was finding that pretty much for any condition, many patients saw benefit. So it is true, our nerves are all different, right? And it depends on what kind of disease we have, or if we've had an injury, or we have a chronic neurological disease that causes destruction of, you know, the normal receptors for pain and the behaviors of pain. So we did do some back injections, direct injections into the back, into the spine. And many patients found a lot of benefit, just like they would with some of the Western medicine techniques of epidural injections into the spine. So we're putting a patch on the area of greatest need, maybe on the back. And so I would say that everyone just has to try it and see if it's helpful to them, not give up right away. I give it the number of months I've said earlier, but the basic way the ice wave patch works is to interrupt pain in the connective tissue and the signaling there. Something like X39 is going to work more by reducing inflammation and not just treating the pain, but reducing the inflammation area to start. Eon, same way.
Thank you, Dr. Patty. We have another quick question in here. How many X39s can you use on the body at one time, and do they need to be a certain distance apart?
I would just use one. I know there are people and there are many advanced techniques and protocols, but I don't know that, you know, I mean, it'd be nice to hear David Schmidt answer that question, but I don't believe he's done a lot of studies, at least not that I know of, with doing more than one. And so I wouldn't see the need for more than one. I just do one. You know, maybe if you had something really severe, like a really big injury, maybe Marcy could talk to that next time she's back to see if she used more than one X39 on her wrist. But I think one is significant enough, and just give it time to work, move it around a little bit on the body, maybe add the Eon as a supporting patch, or X49. I would go to more of different patches that work on different pathways before I think I would double like an X39. But that's just my preference, and I don't really know if there are any studies out there that show a difference. If you are decide you want to use more than one, you can try it and just put it right below. Some people even talk about stacking, where they literally put it right on top of the other one. Jan was saying, you know, you don't even have to put it directly on the skin. So you could put them kissing or separate them. You could try it.
This is Victoria. I have heard David talk about the use of a second patch.
Oh,
You
good.
could get 20 to 30% more stem cells if you use a second patch, and that it would be wasteful to use more than that.
Oh, great. Okay, that's very
I've
helpful.
heard
Thank
him
you.
say that too. I think he said that in my interview with him.
Oh.
So yes, David has said, because you're just adding more. It's not that it's going to start making more necessarily, but like Victoria said, 20%. So that's a $5 patch retail. Think about that. Okay. Linda, please lower your hand and ask your question, or I'll lower your hand. You unmute yourself. Where'd she go? We can't hear you, Linda, honey. You have to unmute.
There we go. Yes. Thank you. I have broken out in a rash. It started on my neck, and then I have it on my torso and on arms and across my navel area. And I've stopped using, I used the glutathione maybe twice, and I have the X39 every day. It's been 3 weeks and the itch is ridiculous. It's really bad. So I've never had anything, you know, allergic reactions to anything. So I don't know what's causing this.
Right. And that again, would be something that I would recommend that you go to some primary doctor or a dermatologist and have them take a look at it to see, you know, what it could be. Is it possible that, I always tell my patients anything is possible, that, you know, maybe glutathione stimulated something in your body as a detox, and sometimes rashes can be detox. But something that's persisting like that, I would say, you know, you would not want to immediately necessarily attribute it to the patch use. And you would want to have that looked at to make sure that it's being treated properly.
I did go to the primary care and they kind of laughed. They said they have absolutely no clue, nothing. And I didn't tell them about the patches, but they had no idea what it could be. So, nothing's changed versus they go through the basic, things,
Right.
heating or laundry detergent. But I figured it had to be one of the patches, possibly the glutathione.
It's possible. It doesn't sound like a normal thing that would continue for so long, but what the regular PCPs will do is they usually will want to give you steroids, tell you to take Benadryl. Benadryl isn't quite as serious as steroids, and so sometimes that can be helpful to patients in the interim. But I always, we really look at, as a functional medicine doctor, we look at food, and I ask them to stop the foods that are the most problematic, and that's gluten and dairy. Both gluten and dairy have proteins in them, and those proteins mimic proteins in our body. And so when gluten and dairy get out of your gut into your bloodstream, your body's not real sure what to do except to start trying to take out the gluten and the dairy, and then inflammation results. So I always tell patients, start with those, start with all the things they've already told you, looking at what you're wearing and how you're washing it and the soap you're using and all those things too. But if something continues, then it's important to have it looked at, because it could be yeast or be something else that was causing it.
All right, thank you.
Mm-hmm.
Dr. DiBlasio, could that be a Herxheimer reaction?
So I would call it more of a detox reaction if it was related to the patch of glutathione. So I would call it a detox reaction. I call a Herxheimer maybe one that's a little bit more like if you're taking an antibiotic for Lyme disease and something comes out, because that's a little more related to viruses and bacteria. But rashes do happen and can be a result of something, but usually something like that resolves a little more quickly. But, everyone's sensitive, so it's hard to know for sure.
Right. Suzanne, you have your hand up. You want to unmute for us, Miss McGee? Where'd you go? Suzanne?
Here. While we're waiting for her, there's a question that says, can you use the X39 patch if a dermatologist prescribed chemotherapy cream for a spot on skin?
So I'm not real sure which specific thing you're talking about as far as what's been prescribed for skin. So I really can't comment. I do know that there is a cream called tacrolimus, and sometimes it's connected a little bit to a chemotherapy drug. Tacrolimus is something that sometimes the dermatologists use. So again, if you're under the cares of a specific physician, you need to follow through with their care first. And if you try to add something during that time, let them know about it and get them to weigh in. They usually don't know anything, but at the same time, they're the ones that are treating. Once you stop treatment, as a patient elects to stop treatment with that doctor, then they can resume maybe treatment with a functional medicine doctor. So I can't really comment on that.
Okay. Did we lose? Oh,
Okay, there's one other one. Should we not put any patches on scar tissue in the beginning with clients? A massage therapist client had a severe internal reaction from X39 under navel first days, told her detoxing.
I guess, like I said, anything is possible. I do know I've heard of a number of people that do use it on scars, and the scars have gone away and have felt it to be very beneficial. So I guess I always tell patients, medicine is not just a science. In fact, it's really even more so an art, because we're all individual, unique individuals. And many of us in these fields, we're in these fields because we are more sensitive maybe than the average person. And so I think that it's really important just to remember that. And, we may just have to do some trial and error from time to time to see if it's beneficial. But certainly if it's an active wound or scar, you would put it on, an active wound, you would put it around the edges, but a scar, you could try it on or off. I can't really say for sure about that, but I know some people that have benefited using it on scars.
Thank you. Denise, you have a question.
Yeah, with the holidays just, gone by, I've noticed that while using the patches, I've been a lot more sensitive to alcohol consumption. Is it just me, or do other people have this side effect?
You said that you've been more sensitive when you consume alcohol
Yeah,
after wearing the, as a result of wearing the patches?
yeah.
Mhm.
It just seems like they just don't go together, which I'd much rather give up drinking, but I'm just saying, I never really noticed before that it's almost like I get hot flashes, or it's almost pushing me away from alcohol.
Right, right.
Anybody else has the
I
same.
think that's a great thing. I tell my
Yeah.
patients not to drink, period, because it's a poison. Literally, alcohol is a toxin to every organ in your body. And so you're going to have to detox after you drink, right? For women, we know it actually increases your risk for breast cancer. And for men and women, it increases your risk for colon, esophageal, and stomach cancers, and maybe even more. It raises your blood sugar. It is not good for your liver. Every time you drink, you lose neurons in your brain. So I say, you know what? Let's just take the higher road, get a mocktail. If you need to feel like you need to have something in your hand, use sparkling water. And I think it's better. So maybe your body's becoming wiser and more healthy with the patches, and listen to that inner wisdom. So that's very interesting. I think some other people are adding that to the chat right now too. Anyone else want to speak on that?
I don't drink, so for me, it's not a.
Right. I look like a few people were putting something on a chat.
There's
yeah.
a higher alcohol sensitivity.
Yeah.
Unfortunately, I've never had that problem.
And you can use the SP6 to take away the craving, right?
Right. There you go. There you go. Or you can do some NLP and map across alcohol into the pile of something you don't like, and you don't want to have to drink it then.
Right.
That works too. Okay, Yin Yan has her hand up, and then we'll go to Kojo.
Hi. Yeah, I had put it earlier in the chat about say you've been using the patches for over a year, and the symptoms that you're hoping to address have not improved at all. And then the suggestion I've heard in the past was, add, certain supplements, particularly copper. But for someone who has a past history of cancer, I've been told that copper can actually fuel tumor growth. And Dr. Harmon tried to address it by saying maybe you could use chlorophyll, or I couldn't remember, was it cholera, some kind of greens thing. But in general, what do you tell people who are hesitant about using it because it elevates GHK copper peptide? Is this type of copper peptide possibly linked to tumor growth?
So all your questions are good, and I would recommend that you work with, an integrative medicine, practitioner, chiropractor, acupuncturist, who is versed in this and could help you more with that. As far as the GHK copper, I'm glad you asked that question, because that's what I thought initially when I was introduced to that peptide several years ago. And I was recommending that my patients be tested for copper just to make sure everything was okay, and no one ever had increased copper rates at all. But then over time, I began to read and study and learn more. And so what the copper is doing, it's just a molecule that is sort of like a chaperone. It's ushering in the GHK into the body. And so in theory and in science, it can't increase your copper levels. If that's something you want to just double check in yourself, you can check copper levels in your blood from time to time as well. but it shouldn't be a problem on a regular basis. But, you know, if you have something like what you have, you might want to just double check to put yourself at ease as well.
Okay, thank you.
Okay.
Next up, we
Bob,
have
Bob has a
Kojo
question?
first and then
Oh,
Bob.
okay, thanks. Bob, you're after Kojo.
Good morning.
Morning.
I have someone
No.
who's interested in how the X49, where they read that it has helpful issues with early dementia possibly, or as far as how it affects and helps to affect things in the brain. Could you elaborate on that? Or he was basically asking, do any of the patches, and of course X39, but do any of the patches help with what he terms early dementia? That's all.
I'm not sure we have any studies on that. I haven't seen those myself. There might be something on there. So we can't, you know, say these are good for dementia. I will say that anything that's rejuvenative, that's helping to reset your genes and repair and restore, might be beneficial. And if someone is starting in with dementia and seeing early signs of it, it's like, you know, you want to go for the Hail Mary, you want to try to do something, right? That would be helpful. So many of the drugs that are out there, the big farm drugs, they have so many side effects and very little benefit. Aricept and some of those have just not really, they've been such minimal benefit, if anything, and for only a short period of time. So I would say stem cells are reparative and they're regenerative. GHK copper is the same way. So it certainly would be, I think, one of the best bets someone could try. And I would certainly recommend it for patients and for family members, and because many of the neurological diseases do have issues with cognition. Carnosine is one, I haven't specifically heard about X49 doing that. Carnosine I know is especially good for the brain, but any of the stem cell patches could also have that potential to be beneficial. But again, if that person is working with a doctor, they need to run it by them first. But those would be some things that you could look at with X39, 49, and carnosine would probably be the first places I would go outside of EON. It's nice to be able to determine what might be causing that and rule out, is this an inflammatory process in this person? Are they younger and maybe they got bit by a tick and we're concerned about Lyme disease? You know, what are the root causes if we can get to that? But if it just seems to be general dementia, then you would, you know, look at several of the patches might be something that could be helpful.
Thank you.
Kojo, we have in our Telegram library of testimonials an absolutely amazing testimonial where a couple talked to mom. Mom is sitting in a chair. They ask her specific questions. Who's the president? I think what year it is, some other things. And she cannot express any of it. And then they follow up with her, patching her, and come back and ask those questions. And it's different. So I know that's not doctor research, but that is in, you know, real life people using it. So there are different ones, different Telegram testimonials.
Yes, and you can just type that in on the Telegram, you know, to search for dementia or whatever, and maybe see some of those. I saw that too, Sheila. That was really an incredible video.
It really has been. And I do know that there are other people that have my friend Kathleen Nichols, her father's girlfriend had severe brain problems and seeing dementia and different stuff, and has really turned that around. So the stories are out there. There are testimonials and the brain mapping studies that we have too. So Bob, you are up. Please, sir, unmute and ask your question. Okay, I know you're unmuted, but we can't hear you. Is your mic turned up? Unless anybody else can hear him and it's just me.
I can't hear him either.
Mm-mm.
Your lips are moving, but nothing's coming out.
Maybe he could text his question.
Yeah, put it in the chat.
in the chat.
Bob, ask your question in the chat.
And then Denise, we do not recommend pregnant women wearing patches. They've never been studied. David will not do a study on that. That's personally between the doctor and the woman. Let's see. Dr. Patty, they didn't hear you say can or can't increase. So to clarify, does GHK copper does not increase the copper levels in your body, correct?
So to my best knowledge, and I was initially concerned it might, it does not. It is a chaperone molecule, what we call in medicine a chaperone molecule, meaning it attaches itself to the GHK copper amino acid complex and ushers it into the body for use. And so it's not increasing the copper in the body as far as the mechanism of it. I even checked that some with patients and with myself just to make sure early on, and I never saw any increase in copper in the sample size of patients I had. If you're concerned about it, certainly check it just to put your mind at ease. But it's mechanistically and physiologically, it should not do that. Should not do that. But you can check and see as well via a blood test.
Okay, does anybody else have a question? I think Bob's typing his question for us. So anyone else while we're waiting for Bob's question to come through? Okay, been on all the patches 3 years this month, moved to state, and recently feel my joints are aching, neck and hands. Thoughts?
Move back to California.
I know, I'm thinking, Heidi, move to Hawaii.
I think that brings up a point, though, that's really good. There's one thing everybody should be doing. It's super cheap, and it will help lay the foundation for all of the patches and everything else. And that's making sure your vitamin D level is at least 60 or above. I like my patients to be 70 to 80. Your regular doctor will tell you if it's 30, it's fine. And even Western medicine during COVID found that people that had levels of vitamin D below 55 were more likely to be sicker, to get sick and to be sicker with COVID. So we know that vitamin D is important. Now, people think they get it from the sun. You really don't. You'd have to live at the equator and in a place where you never had clouds or pollution to really get the UVB rays that are what we get, where we get our vitamin D to synthesize in our body. So this winter now, I would say the first thing I'd do if I was aching all over, I would make sure my vitamin D is good. You can have it checked with your primary doctor. Usually they will. You can also get a home kit online for $50 if you want to just do a finger prick that they send you and check it that way. And I recommend checking vitamin D twice a year, once you come out of winter and once you're going into winter, and really try to make sure you keep that level up at least 60 to 70. For most people, they have to take 10,000 international units a day to get their vitamin level up. Even Western medicine does a pill that gives you 50,000 a week. So you want to make sure you get a good amount to get it up there. And then you can usually maintain it somewhere around 5,000 a day. So that's the first thing I would recommend, is making sure your vitamin D level is up.
Can you have too much vitamin D?
You can. That's usually not a problem for most people. My husband is someone that just obviously synthesizes it well, and he's a runner, so he is out, and I do live in Southern California, so he gets a little more from the sun. And so we watch that. He only needs 5,000 about 3 times a week. So you follow it, you check it every 3 months until you get to the level at least 60, 70 to 80. And then you find what is your maintenance dose. You follow that another 3 months later, and then you find your maintenance dose, and you can keep it at that. I think anything over 100 is a little bit elevated, so I'd keep it below 100.
Where do you get these tests? The vitamin D test?
There's a company called Everly, like EV as in Victor, ERLY, Everly. And they actually will send you a home kit. If you join their little program for 3 months, I think you can get it for maybe like $30 instead of 50, but then you have to do a couple of other tests with them, but it's called Everly. And then the second word is Well, W-E-L-L. But you can Google it and you'll find a number of different places. I think they're the one that I've vetted as to be the most accurate. I like that HomeKit and I've used it myself. It's pretty good.
Thank you. Good.
Beautiful. So Bob wrote, new people say they will try the patches for 30 days and they think that way because they look at the patch as a drug. But what you need to explain to them is there are no chemicals, no drugs, nothing enters your body from the patch. Light frequency is reflected back. Is that correct, Dr. Patty?
That's true. That's exactly right. And that's what makes to me so wonderful, because I'm always looking at benefit and risk for a patient on everything we do. So you get the maximum benefit, the lowest risk, and it's the risk basically is if you get a little rash when you're using the patch, or you're putting in money and you're feeling like you're not getting a benefit, just know that you are. I truly believe it's working. It just may take more time for you to feel that. So absolutely, I think X39 is a vitamin, something to use every day for sure.
May I comment on something, Sheila?
Please, Bob.
Okay, guys, one of the most important things to do, and Bob, this would be for you too, is you must manage the expectations of your potential client. Now, Annie Coker, who's a presidential director, says this to people. She says, typically half the people see some sort of results within the first 3 to 6 weeks, the other half in the first 3 to 6 months. That's the way you get them off the thought of 30 days. So if you'll remember that typically half the people see results within 3 to 6 weeks, the other half in 3 to 6 months. Me personally, it took 7 months before I saw any relief in my pain that I've had for over 40 years. So it's all about managing expectations.
That's right. Thank you so much, Bob. And here's some information that Kathleen Nichols pulled out of our researches, our brain mapping study and some other studies. So this is data that you can actually go read all those studies and you can conclude this for yourself, like she brought out. At 6 weeks, our brain is balancing. We have the two halves, the hemispheres are balancing, which helps with PTSD, anxiety, and depression. At 2 months, your heart is becoming younger. Okay, so all of that speaks to. At 3 months, collagen repair kicks in. And then at 6 months, you are starting to reverse your biological age. So if somebody has to have some form of a timeline, that's probably the only timeline I ever use. And another way is, especially if you're, I know Bob Campbell doesn't give out samples, gifts, patches. Okay, but if you are, what you can do is say, I don't expect that you're going to feel anything happen from this patch today. Okay, because 3 to 6 weeks is normal for half of the people. Okay, so again, like Bob is saying, you have to manage their expectations. Any other questions that we've got? We are at 7:59. I can't believe pain came back, knees stiff and painful after doing great for after a year. Faithfully placed X39. What's up with that? You know, I found honestly, Dr. Patty, do you have any ideas on that one? But the thing that I'm hitting on is you have to check, like what Dr. Patty already said, dairy, all of those, the food things. Are you feeling more inflammation? I am being inflamed because I went back to coffee with cream and sugar. And I'm done with it now because you feel differently. Dr. Patty, what can you say to that? You're muted, sweetheart.
I do agree for sure with Sheila. And those are some things that just take some time to really delve into, and you need a good practitioner to look at that with you and try to determine, because it is a problem, and you want to look at, see what the root is. That's what we're always doing, is looking for the root cause, not trying to treat up here, but looking for the root causes.
Okay, well, we are at 8 o'clock, and I apologize if your questions didn't get answered. We are here every week at 7 Hawaii time, 9 Pacific time, noon Eastern Coast time with practitioners, and the practitioners call normally with Marcy. And we thank you so much, Dr. Patty, for being here and answering all of these questions. We thank you, all of our Ohana, our family that came today and asked these amazing questions, because somebody else had that question that you asked, and now it's answered for them as well. Thank you, Jan, for being my beautiful co-host here today. And everybody, go out and patch somebody, okay? But just remember, you got to have a smile on your face, and you have to be really confident and sincere when you're patching them, okay?
Yep.
Mahalo.
All
Have a
right.
blessed
Bless
day,
you.
everybody.
Thank you, Sheila.
Bye-bye
Bye,
now.
everyone. Have a great day. We'll see you at the 6 o'clock
Thank you.
testimonial call.
Patching podcast tonight.
Thank
Bring
you
a
all.
friend.
Excellent. Thank you.
Thank you,
Thank
guys.
you.
Great
Bye.
call.
Thank you, ladies.
You're welcome. Bye-bye.
Bye,
Thank
Bob.
you.